Humerus is a long bone and the only bone in the upper arm. The humerus extends from the scapula of the shoulder to the ulna and radius of the lower arm. The humerus provides support for major muscles of the shoulder, the upper arm, as well as the lower arm. The humerus is essential to arm functions such as lifting, pulling, riding, and throwing. At the proximal end of the humerus is the head of the humerus. The head is a round ball which projects medially and superiorly. The head articulates with the glenoid cavity of the scapula. The head of the humerus and glenoid cavity form the glenohumeral joint, commonly known as the shoulder joint. The head of the humerus is separated from the greater and lesser tubercles by the anatomical neck. The anatomical neck serves as the attachment point for the articular capsule, a synovial-filled fluid cavity used to lubricate the shoulder joint. The supraspinatus, infraspinatus, and teres minor muscle attach at the greater tubercle, a large projection on the lateral side of the humerus. On the anterior side, the subscapularis muscle attaches to a small projection, the lesser tubercle. The intertubercular sulcus, located on the anterior side of the humerus, is a pathway for the tendon of the long head of the biceps brachii muscle. This runs between the pectoralis major on the lateral side and the teres major on the medial side. These muscles are used to adduct and medially rotate the humerus. The surgical neck is a narrow section below the greater and lesser tubercles which meets with the shaft. The surgical neck is most often the sites of fractures of the humerus. On the shaft, the deltoid tuberosity is a roughened area on the lateral side and is the attachment point for the deltoid muscle. The radial groove on the posterior side of the humerus is a shallow pathway for the radial nerve and the deep brachial artery. At the distal end of the humerus, in the elbow region, is the medial epicondyle. This is a knuckle-like, non-articular process and the attachment point for several muscles. The names of these muscles are the flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum, pronator teres, and flexor pollicis longus. When the medial epicondyle is hit or bumped, it causes a painful tingling sensation in the ulnar nerve. This is commonly known as hitting your funny bone. Located at the distal end of the humerus are three depressions. The olecranon fossa is located on the posterior side of the humerus and articulates with the olecranon process of the ulna. The coronoid fossa is located on the anterior side and articulates with the coronoid process of the ulna. Also on the anterior side of the humerus is the radial fossa, where the head of the radius articulates. The humerus is one of the most frequently damaged bones in the body and plays a major role in sports-related injuries. Lateral epicondylitis, also known as tennis elbow. Tennis elbow usually is caused by repeated contraction of the forearm muscles that you use to straighten and raise your hand and wrist. The constant pulling of these muscles puts too much stress on the tendons. This causes microscopic tears in the tendon that attaches to the lateral epicondyle. Rotator cuff injuries are also quite common and the leading cause for shoulder pain. These injuries are to the four muscles and tendons forming a cuff around the head of the humerus. The four muscles which form the cuff are the teres minor, infraspinatus, supraspinatus, and the subscapularis. The group provides stability to the shoulder and work in tandem to rotate the shoulder. The two most common types of rotator cuff injuries are tears and degeneration. The severity of injury may range from a mild strain and inflammation of the tendon that will lead to no permanent damage, or to a partial or complete tear of the muscle that may require surgery for repair. The humerus is located at a keystone place between the pectoral girdle and the bones of the forearm. Important muscles moving the arm and forearm originate and insert on the humerus. Because of its structure and physiology, damage to any section of the humerus could lead to loss of certain functions of the shoulder, the arm, and the hand.